It seems to make a big difference if a person in the hospital is in the hospital for COVID-19 or with COVID-19. It's been almost a year since you've been running the agency. Do we have that split on numbers?
What I will say is it differs by each variant. So some variants, first of all, we're doing screening of many, in many hospitals of everybody who's walking in the door. What we're seeing with the Omicron variant is that it tends to be milder person by person, but given how large the numbers are, that we're seeing more and more cases come into the hospital. In some hospitals that we've talked to, up to 40% of the patients who are coming in with COVID are coming in not because they're sick with COVID, but because they're coming in with something else and have had COVID or the Omicron variant detected.
Right. But I guess, do you know how many of the 836,000 deaths in the U.S. linked to COVID are from COVID, or how many are with COVID, but they had other comorbidities? Do you have that breakdown?
Yes, of course. With Omicron, we're following that very carefully. Our death registry, of course, takes a few weeks to collect. And of course, Omicron has just been with us for a few weeks, but those data will be forthcoming.
Take a look. So the hospitals are still stretched thin because of this. So I'm not trying to take away from that. But if 40% in some hospitals, 40% of the people who have COVID don't necessarily have problematic COVID. They're there because they got in a car accident. They're there because, they bumped their head. And they're being included as in the hospital with COVID. That number seems kind of misleading.
Yeah, I agree, Jake. It surprises me that they have not been able to parse out that data more carefully. I think the data that Dr. Walensky is quoting is from New York State, and we've been following that data as well. And I can show you what we've seen, sort of tracks with what she said. But out of all the patients that are in the hospital, about 57%, these are COVID patients, admitted because of or complications from COVID, 43% admitted for other reasons and then diagnosed with COVID. I think, there needs to be transparency about that in terms of for or with COVID. The only thing I will tell you, Jake, again, working in the hospital, is that at the time someone is then diagnosed with COVID, even if they didn't come in for that reason, it does take up a lot of resources then in terms of infection protocols, personal protective equipment, more testing, all that kind of stuff. So even though that may not have been the initial impetus to bring them in the hospital, it just requires a lot of energy and resources on behalf of the hospital staff and the testing and all that sort of stuff. So we need to get better about being able to see this data. New York State, I think, is one of the few states that's presenting it that way, for or with COVID, but other states should follow suit. The American Health Association says they have a hard time sort of separating out that data, but clearly New York State's been able to do it. Other states should do it as well.
Yeah, we're 2 years into this, and we need the clearest picture possible. If somebody's in the hospital with a broken leg and they also have asymptomatic COVID, that should not be counted as hospitalized with COVID, clearly.
So again, CNN
out this morning, this new study showing just how well vaccines are working to prevent severe illness. Given that, is it time to start rethinking how we're living with this virus, that it's potentially here to stay?
Really important study, if I may just summarize it, a study of 1.2 million people who were vaccinated between December and October, and demonstrated that severe disease occurred in about 0.015% of the people who are received their primary series, and death in 0.003% of those people. The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really these are people who were unwell to begin with. And yes, really encouraging news in the context of Omicron. This means not only just to get your primary series, but to get your booster series. And yes, we're really encouraged by these results.
All right, guys. So she's saying